This is the first video on acid reflux and will discuss symptoms. What is acid reflux? Normally, acid is produced in the stomach to aid in digestion. In healthy people, this acid remains in the stomach. At the bottom of the esophagus is a circular layer of muscles called the sphincter. The normal function of the sphincter is to act like a one-way valve. It opens when there is food or liquid in the esophagus, allowing it to enter the stomach. If the esophagus is empty, the sphincter is closed, as is shown here. In acid reflux, the sphincter has lost its regular tone and is relaxed and open even when there is no food or liquids in the esophagus. This allows stomach acid and other contents of the stomach to backflow into the esophagus. The word reflux comes from the Greek word meaning backflow, and usually refers to backflow of stomach contents. The stomach acid damages the lining of the esophagus, as the lining is very sensitive to acid. Your doctor might refer to acid reflux as Gastro Esophageal Reflux Disease, or GERD in short form. Symptoms of acid reflux can be broadly categorized into two types. One is called typical symptoms, the other atypical symptoms. This picture shows you the two typical symptoms. These are heartburn and regurgitation. Heartburn is a common symptom of acid reflux and is a burning feeling over the central chest. This usually occurs after meals, particularly after drinking coffee, alcohol, or eating spicy foods. Regurgitation is another symptom and is common and is the backflow of acid and undigested food into the mouth. It's the sensation of acid backing up into your throat or mouth and can produce a sour or bitter taste. Heartburn and regurgitation are the two commonest symptoms and are typical of acid reflux. Then you have the symptoms that are not typical of acid reflux. These atypical symptoms can occur in acid reflux but also in other medical conditions. These include discomfort or pain in the region of the stomach. Sore throat and hoarseness of voice is another symptom. These symptoms usually occur when you wake up in the morning. Acid reflux is worse when you lie flat in bed, as there is no gravity to push the acid down. The stomach acid then backflows up the esophagus and splashes on the throat and voice box. This causes the sore throat and hoarseness when you wake up. Often the patient consults a throat doctor. Cough, especially when you are sleeping at night, is another symptom of acid reflux. Often acid reflux is worse at night because acid is more likely to backflow when you are lying flat. During backflow, some of the acid can enter the lungs, causing a cough or triggering an asthma attack. Sometimes, the only symptom is cough or asthma, and the patient might consult a chest doctor. Difficulty in swallowing or pain during swallowing is another symptom. Sometimes the patient has chest pain. It may be mistaken for a heart attack. Management will depend on whether the symptoms are typical or atypical. If one has heartburn and regurgitation, which are mild and infrequent, then one can try some home remedy. Mild means it does not impair your quality of life. Infrequent means symptoms occurring less than twice a week. Those who have moderate to severe symptoms, frequent and impaired quality of life, should see a doctor. Those who have atypical symptoms should also see a doctor.